Welcome back to What's Now, continuing discussing your health with the holidays pretty much here. What can you do to focus on your health and not lose track of your goals and maybe create a healthier lifestyle? Well, I recently spoke with two individuals, a doctor and his patient, all about this. Let's take a look.
Obesity is on the rise, already affecting more than 106 million Americans. With that comes a list of serious health risks, yet people are still gaining weight. So before the holiday celebration season and larger meals, how can you take control with a lifestyle plan and realistic goals? From making small changes to knowing when to consider surgical intervention, Dr. John Olsofka with the University of Louisville Health and Mary and Elizabeth Hospital Bariatric Program joins us with some advice. With him is his patient Aisha Neal, who's had an inspiring transformation. Thank you both of you for joining us today.
Thank you for the opportunity.
Thank you.
Dr. Olsofka, obesity continues to be an issue in this country, and based on a recent survey, the pandemic didn't help. What stood out most for you?
Well, I think in the United States, what we're seeing are two diseases collide. So we've got a worldwide pandemic with COVID-19 and the virus, and then a well established but growing epidemic with obesity. And furthermore, these diseases are feeding off each other. The COVID-19 virus is more infective and has more serious complications in the obese patient, but also our efforts to curtail the virus with things such as lockdowns and social isolation has led to an increase in the prevalence of obesity.
We're bombarded with diet plans everywhere, yet people are still gaining weight. What's a manageable step one to make a change that folks can stick to?
Well, I think the first thing that has to happen is a commitment to change. You cannot keep doing the same thing and kicking the solution down the road because the problem only increases. With that said, I would say a simple step one would be limiting or eliminating these high calorie beverages, such as sodas, sweet teas, and those wonderful holiday drinks and lattes we start seeing this time of year. And then I would consider talking to my physician because they have the resources, such as dietitians, to develop a treatment plan, which can consist of anything such as dietary modifications and also safe surgical intervention.
Many people are turning to bariatric surgery, lap band surgery. What is it, and when should that be considered, and what are the risks?
Well, it is surgery, so there are always risks that are associated with surgery. However, the risk of doing nothing and the comorbidities with obesity, such as diabetes and hypertension and cardiovascular disease, far outweighs the risk of any of the surgical procedures out there. With that said, there are different types of surgical procedures. There are the stapling procedures, which staple part of the stomach or the intestine. And then there are the non stapling procedures, such as the lap band. It is the lap band procedure that we focus on in our practice. It is the safest procedure that's out there. It is done as an outpatient, takes about 45 minutes with no restriction to activity and a quick return to work. Also, it's adjustable. So we're able to adjust the amount of restriction and tailor the weight loss program to a patient's specific needs.
Aisha, why did you opt for surgery, and how has your life changed since the procedure?
Yeah, so obesity runs on both sides of my family, along with diabetes, heart disease, high blood pressure, and high cholesterol. And so when I was a young adult and I weighed about 300 pounds, it was just very difficult for me. And I also at times suffered from having low self esteem. So I did try exercising, eating healthier, and even diet pills, but none of those methods really worked for me. So then I decided let's do a little bit of research and discovered that weight loss surgery was the best choice for me, and I did opt to receive the lap band procedure. I did receive the lap band procedure 16 years ago, and I lost over 100 pounds. So I am healthier. I feel a lot better, and I'm way more active than I was before the procedure. And another big win for me is the clothing expenses has decreased due to the fact that I no longer have to shop in the plus size department. So the transformation process has been wonderful, and I'm really glad that I decided years ago to have this procedure.
And Aisha, what were some of the challenges you had in your recovery?
some of the challenges I had in my recovery was sticking to the rules. One of the ones that I struggled with in particular was the you can't drink liquids after eating meals within an hour, about an hour time frame. So that was one that I struggled with at times. And just understanding that I could not, eat off of a regular plate. I had to start resorting to a saucer size plate, like a kid size, and ordering kids meals if I was going out, I had to get kids meal for lunch. I can't get, a regular meal. So I think just adjusting to the rules and understanding that, the restrictions and what I could and could not do, and even can and cannot do to this day sometimes can be challenging, but I always get on track if I do get off track and get back with it. So which led to me, having the success.
Dr. Olsofka, what advice would you share with anyone considering surgery?
Well, I think there's a misconception that's out there that surgery is the easy way out. And I think Aisha will say that certainly that's not the case. It does involve work and commitment. The one thing about the lap band, as mentioned, is that it is adjustable. And we've been able to adjust that through the 16 years and your course of success. And so if you're sick and tired of being sick and tired, then consider surgery as a frontline option, and specifically the lap band.
And where can we get more information about everything we've talked about today?
Well, you can certainly talk to your physician, but you can also go to lapband.com, and that's a comprehensive website that looks at the risks and benefits of all the procedures, shares success stories, but also can guide you to find a qualified surgeon and program near you.
Well, thank you so much, Dr. Olsofka, for joining us today with some important information about this surgery. And Aisha, I really appreciate you sharing your personal story with us. Thanks so much to both
Thank
of
you.
Thank you.